Tennis leg explained by Digital Medicine MSK. Tennis leg is a painful tear in the medial head of the gastrocnemius muscle, which is a crucial part of the calf. This injury can be quite debilitating. This muscle plays a vital role in plantiflexing the ankle and bending the knee, essential movements for walking and running. It's often injured during activities that involve sudden stops and starts, such as tennis, basketball, and other high-intensity sports. People over the age of 40 are more susceptible to this injury due to the natural weakening of muscles with age, making them more prone to tears. Surprisingly, everyday activities like walking upstairs or lifting groceries can also lead to this painful injury if the muscle is strained. The disorder was first described by Hood in 1884. For decades, it has been regarded as a ruptured plantaris tendon, but careful clinical examination of patients suffering from this disorder shows this to be false. The history is quite simple. During a vigorous contraction, for example, when starting to sprint, pushing a car, or lifting a heavy weight, the patient experienced sudden severe pain in the calf. From then on, the patient was unable to dorsiflex the foot during walking and needed to tiptoe on the affected side. Examination reveals pain during resisted plantiflexion, but usually no weakness. In the supine lying position, dorsiflexion at the ankle is found to be markedly limited when the knee is in the extended position but becomes normal when the knee is flexed. This implicates the gastrocnemius muscle, part of which is in spasm around the tear. The difference in range between a flexed and an extended knee in a disorder of the gastrocnemius muscle is another example of the constant length phenomenon. Palpation of the calf reveals the tender area in the medial gastrocnemius, with either swelling and hematoma if the lesion is recent, or induration around the tear if it is old. After a severe rupture, it is possible to palpate the gap in the medial gastrocnemius. Ultrasonography is the imaging technique of choice to demonstrate size and grade of the lesion. Diagnosis starts with a medical history and physical exam. Your doctor will check for tenderness, swelling, and bruising in the calf. The Thompson test helps differentiate from Achilles tendon rupture. Imaging tests like ultrasound or MRI may be used to confirm the diagnosis. Ultrasound visualizes muscle tears while MRI provides detailed images. These tests help identify the extent of the injury. It's crucial to differentiate tennis leg from other conditions like deep vein thrombosis, DVT, and Achilles tendon rupture. DVT causes widespread swelling, warmth, and redness. Achilles tendon rupture involves pain closer to the heel and a popping sensation. Accurate diagnosis ensures appropriate treatment. Doctors use patient history, physical exams, and imaging to differentiate these conditions. Most cases of tennis leg heal without surgery. Different types of treatment have been advocated for tennis leg. In our opinion, surgery for this condition is scarcely ever necessary, and partial or total immobilization by plaster cast or strapping is obsolete. When such treatment is instituted, the formation of a chronic adherent scar is promoted, which results in disability lasting several months. The aim of treatment in muscle tears is to allow the torn fibers to heal in such a way that mobile and functional scar tissue is formed. If normal enlargement of the muscle is impaired by adhesions, self-perpetuating inflammation will be the result. Muscle belly lesions, tennis leg is an excellent example, therefore need a different and more functional approach. The aim must be to restore normal movement in the damaged muscle as quickly as possible. This can be achieved with combined treatment, early compression to decrease the amount of hemorrhage, aspiration and infiltration with local anesthetic as soon as the patient is seen, and deep transverse friction and electrically stimulated or active contractions of the muscle during the next few days. During the recovery period, the muscle must be protected by a raised heel pad, which enables the patient to use the unaffected parts of the gastrocnemius without strain on the line of healing. Surgery is reserved for cases unresponsive to conservative treatment. With proper treatment and dedication, recovery from tennis leg can take anywhere from a few weeks to several months, depending on the severity of the injury and the individual's overall health. It's crucial to follow your doctor's instructions carefully and gradually increase your activity level to avoid re-injury. Understanding the causes and treatment options for muscle injuries helps in both recovery and prevention of future issues. Always see a doctor for sudden calf pain to get an accurate diagnosis and appropriate treatment plan tailored to your needs.